Health, your weekly dose of health and wealth information on KUTV.
Welcome back to yet an interactive session on Focus on Health, where we demystify all matters health. My name is Bari Michelle. Today we're going to be talking about pregnancy and vaccination. What are some of the vaccines that are recommended for pregnant ladies, and what are some of the misconceptions that we should actually avoid? But even before we see Daktari on that, here now is the health update. Educative health update, and we're coming to you from the JCK Hospital. Joining us for a conversation today is Dr. Nelly once more, and our topic today is pregnancy and vaccination. Thank you so much for joining us, Daktari.
Thank you too.
How are you doing today?
Fine, thank you.
So Daktari, even before we head on to our discussion, kindly introduce yourself to our viewers.
Thank you. My name is Nelly Mwanuli. I am head nurse JCK Hospital, and I'm happy to be hosted today.
Thank you so much, Daktari. So Daktari, maybe we could even start by defining what vaccination is. How would you define that?
Vaccination is a biological preparation that provides active immunity against a particular infectious disease. In this case, a vaccine contains an agent that resembles a disease-causing microorganism, but in this form, it is either inactivated or it's weakened.
Daktari, we are always encouraged to take vaccines, but what is the importance of this vaccination to our health?
The saying goes, prevention is better than cure. So vaccination is safe and it is an effective way of controlling so many diseases. And by being vaccinated, it is also less costly.
So Daktari, what types of vaccines are recommended before pregnancy?
Before pregnancy, we advise our mothers to visit our clinics, because there are precautions that need to be undertaken for a mother who is considering to conceive. So during these clinical visits, we advise our mothers on diet and supplements. There are tests that we do to ensure that they are safe to conceive. So by so doing, it will greatly reduce the risks that come along with pregnancy, like anemia. So during conception, it is very, very, very key for our mothers to be evaluated health-wise, to be sure that even as they plan to conceive, then the journey is going to be safe and it's going to be easy for them.
Daktari, maybe you could tell us about the consequences of not maybe taking the advice that you've given us.
Yes, there are some complications that arise, especially for those mothers who skip antenatal clinics, and for those who've not been evaluated properly. They get complications during pregnancy and even after. And to avoid that, that's why we advocate for them to visit health facilities, so that we can walk with them during this journey, so that they deliver healthy and safely.
Daktari, now take us through the do's and don'ts during pregnancy.
So if I begin with the do's, for pregnant mothers, we advocate for a healthy diet. And a healthy diet is not just enough for our mothers, because now she's eating for two. So the diet should be well enriched, especially for iron and calcium supplements, because this plays an important role in the development of the fetus in the first trimester. And also we advocate for our mothers to have enough sleep. You know, with the pregnancy we have hormonal imbalances, there is anxiety, and this often causes fatigue. So we advocate for our mothers to have enough sleep, like 7 to 9 hours a day. And also we advocate for exercises. Exercises are very important. Gone are the days when our mothers used to be locked in the house, they are pregnant. But nowadays we advocate for exercises because exercises are very important for our mothers, as this will ensure there is a proper blood circulation, and also it will reduce excessive weight gain. And also it will balance the mood swings. You know, with the hormonal imbalances, when you exercise, the hormones are balanced. And also we advocate, of course, for the clinic visits. We advocate for 4 clinic visits, because they play an important role. And also we advise our mothers to take iron supplements and multivitamins, because this will boost their immunity during the whole process.
You've mentioned something about exercises early on. Maybe Dr. You could guide us on the various types of exercises that are encouraged for pregnant ladies.
We encourage mild exercises because, again, different mothers need to be taken care of differently. So mild exercises, we have Kegels, we have even walking, and minor stretch here and there, yes.
Dr. If I could take you back to what you said about do's and don'ts, maybe you could now guide us more on what are the don'ts during pregnancy.
We caution our mothers on some practices that they should not engage in, like taking alcohol. Alcohol is prohibited because it affects the development of the fetus, and in most cases the mothers who take alcohol throughout their pregnancy period, you find they deliver babies that have what we call fetal alcohol syndrome. The babies are small, they have disabilities, they have derailed milestones, so we discourage that. And also we advocate for the mothers not to smoke, because also smoking hinders proper circulation of blood in the body, so that will eventually affect the fetus. We discourage our mothers from taking over-the-counter medications. The medication that they should take should be prescribed by medical doctors, so that if there are any precautions that need to be taken or they need to be evaluated while on medication, it is done properly. And also we discourage mothers from taking hot baths, jacuzzis. Those hot baths, especially in the first trimester, they increase the risk of miscarriage. So we discourage them from taking raw meat and raw seafoods, because these tend to cause fetal foodborne diseases.
Dr. You've mentioned something about checkups, but how many checkups should we have, between the first trimester to the last trimester?
We have 4 important clinics visit that we advocate for our mothers. And the first clinic, which the mother should attend in the first trimester, is very key, because during this visit we do several tests just to ensure that as the mother begins this process, everything is in check. For instance, we check blood group, we check blood levels, we have urine tests just to ensure that there are no infections. So it's very important for this first visit. And also we have a head-to-toe examination just to rule out any other complication that might arise and interfere with the normal development of the fetus.
And why are these checkups very important to the mother's health?
These checkups are very important, because when we detect an abnormality, especially for instance if the mother's level of hemoglobin is low, then there are corrective measures that we put into place. And this is, we give supplements like the folic acid, the iron supplements. We advise on diet. So you find if a mother adheres to this, then the level of hemoglobin is going to rise to the normal level, and this will prevent complications like anemia and ensure that the baby is developing well.
So Daktari, maybe you could hold on to that thought as we take a slight commercial break. And when we come back, Daktari is going to be telling us more about pregnancy and vaccination. Don't forget to leave your feedback on our social media platforms at Health Focus On Instagram, KUTV Focus on Health on Facebook, and also on YouTube. I will leave you with the Did You Know segment. Do not move a muscle.